Thanks, Suresh. I'm from the law school, as Suresh just mentioned, but I'm going to be talking today about a research program that we've been setting up at the university for the last 18 months or so, which is growing quite rapidly. So the question at the centre of the Administrative Fairness Lab's work is this: can fairer processes in frontline public services promote the public good? You'll be surprised and shocked, I'm sure, to find out that our answer is yes. So we're hoping, through the work of the lab, to develop theory and evidence that helps us understand this question in much more detail. So I'm going to start with a concrete example of the kind of things that we look at. This will be an example I'm sure is familiar to everybody in this room, making a GP's appointment. So there were 343 million GP appointments made last year. Now, the way that we've typically looked at this kind of system in research is we've looked at what we might call outcomes. So we've looked at, do you get the kind of doctor you want to see, or the preferred doctor? Do you get the kind of time slot you want? But there's a really interesting process dimension to this. So if anybody's made a GP appointments recently, you'll find there's digital processes, there's phone processes. Some places won't let you book in person now. They'll turn you away at the desk. There's lots of different ways we can arrange the processes. And recently, we met with a group of patients just to ask them a little bit about their experiences of this. And I won't read these quotes out, but there's lots of what we might call process pain in these systems. Now, these might be small inconveniences, but they might be more substantial barriers as well. So what we're trying to do in the lab is look at everyday public service encounters like this, try to interrogate them, think about the process design choices that are made, and see how they shape whether people think public services are fair. And we're also trying to go a bit beyond that and think about what are the longer-term outcomes of those process interactions for the society in which we live. Now, we think this is a big problem. We've not got a huge amount of evidence, and that's why we set up the lab, because this seems to us to be a really big problem across all of public services. But we've not got a great deal of evidence in academic research, so we're trying to develop the evidence base. One of the reasons that we think this is a problem is because we did some work with YouGov about a year ago, where we did a survey of the British public, a general representative survey, and we asked people about the kinds of public service interactions that they've been having. Who were they speaking to? What kind of services were they relying on? How did they find those interactions? And one of the most interesting pieces of data we got back from that survey is when we asked the question, hypothetically to people, if you had to approach a particular public service in the next 12 months, how confident would you feel that that process that you would go through, that public service process, how confident would you be that you'll be treated fairly when you go through that process? And we got some pretty startling results back. So here are 3 examples. I'll just look at one of these. We asked people if you had to make an adult social care application for either yourself or a member of your family or a friend, how confident would you be that that process would be fair? And only 20% of people said they would be confident that they would be treated fairly. So this is, in subjective terms, in the way that people think about public services, this is a huge problem. People don't have much confidence that public services will treat them fairly when they're in a moment of need or when they need some support. So this is what we call the Administrative Fairness Challenge. So we've been working to try to develop this idea, to conceptualize this challenge, try to understand it, and also try to respond to it. So we break this challenge down into 3 separate questions. So the first is, what do the public think of as fair in frontline public service processes? Okay, so that might seem like a straightforward question, but it's actually quite complex. Now, our starting point is that different kinds of public services, so that might be health services, it might be educational services, social security services, all have different factors in play. So fairness is often, whilst it might have some commonalities in different settings, it's often quite context dependent. So part of the work we're trying to do is to dig into different contexts and understand the details. One of the projects we have in the lab, which is funded by the Nuffield Foundation, is a large study on universal credit. So I'm sure most people will be familiar with this. Universal credit is the main social security benefit in the UK. And what we've been doing is we've been trying to understand how different key stakeholder groups think of fair process in the universal credit processes. So most universal credit processes take place online now. You interact with people who claim universal credit, interact with government officials through an online system. There's automated decision-making going on in the background. There's in-person elements to it as well, but it's mostly online. So this is a really interesting, socially important, in our view, case study. We interviewed DWP officials, and we interviewed the people who are designing this system. And we asked them what they thought their process was. And they told us a load of things that the other groups that I'm going to come on to and talk about in a moment said as well, but they emphasized what we call service design, what we're referring to as service design. So when they're talking about designing a fair process, they're talking about things like the website being accessible, text being clear, processes being quick. Now, these are very, very important things, but they're the kinds of things you might associate with designing a good quality service. So if you're designing an online shopping platform, for instance, it was those kinds of qualities that were being mentioned. When we spoke to welfare rights advisors who help people access universal credit, support them in developing their claims, they emphasized a whole different set of procedural qualities. They were looking for clear reasoning, whether it was easy to complain and challenge decisions, and a bunch of other related factors. And really significantly, most significantly, when we spoke to universal credit recipients, what they emphasized is being treated with respect, not being spoken down to, being shown compassion, being shown a bit of latitude in decisions, and also just essentially being treated with dignity. So whilst all of these different groups were talking about fair process in a broadly similar way, they emphasize different qualities. So what we're trying to do is highlight these kinds of differences and try to bridge misunderstandings in conversations that happen in these areas. The next question we're looking at in the lab is what are the effects of perceived unfair or fair processes? So the basic question here is, if you're interacting with public services, when you have an interaction, what does that do if you have an unfair experience? What does that do to your long-term attitudes and behaviors, whether that's in relation to public services or anything else? So jumping back to the universal credit study I've just mentioned, we were interviewing somebody earlier this year. This is a universal credit recipient. Again, I'm not going to read this out. But essentially, this is a really striking quote in the context of this system. And this person was saying, essentially, I lost my job, I ended up having to seek universal credit. I wanted to work, but the processes that I've been put through have upset me so much, has offended my sense of fairness so much, that essentially I don't want to play the game anymore. I'm going to try to frustrate the system. I don't even really want to seek work because these processes have been so difficult. So what we're seeing here, interestingly, is somebody's attitude to working to society changing as a result of process. And from the DWP's point of view, this is fundamentally frustrating one of the core policies, which is about trying to get people who can work back into work. So the idea that these kind of ideas we're looking at have potentially a huge social effect. And if you think about this across all the people that interact with public services, the potential effects are really significant. Another scheme we've been looking at in the last year or so is the Homes for Ukraine scheme. Many people, I'm sure, will be familiar with this, but essentially it's a system by which refugees from Ukraine can move to the UK as long as they have a sponsor in the UK who can give them a spare room in their house or property that they own. Now, really interestingly, we're noticing in our work is that fairness perceptions of public service processes are not just forged first-hand, they're also forged second-hand. So if you think about what you might expect from a particular public service, it's not necessarily based on your own experiences, but potentially the experiences of your family, your friends, those in your communities, or information that you've got from elsewhere. And in this situation, what you have, to be very broad about it, is a group of effectively middle-class sponsors, relatively wealthy people with spare bedrooms, who have had one experience of public services in the UK for their entire lives, have developed a view of those services, and then all of a sudden, they're re-seeing their own public services through the eyes of their guest, who is a refugee. So they're seeing the public services again through the eyes of a refugee. And what's really interesting about this is we're seeing in the interviews that we conducted with sponsors we were seeing their own attitudes change in relation to public services. So this was a really striking quote. Somebody essentially saying, I used to trust public services, I used to think they worked fairly well, they treat me fairly. I then tried to help my guests access, I think it was education and healthcare in this context. And effectively what's being described here is that they lost trust in government, they lost trust in authority. So these kind of effects travel in interesting ways, and that's also what we're trying to understand. The third main question we're trying to address in the lab is what kind of interventions, what kind of changes can we make to processes so that frontline services operate more fairly and people have more fair experiences. So I'm just going to talk about a few examples. Now, we've not really started with our intervention phase of our work, but that's what we're trying to look at in the future. So one of the issues that we're looking at is often when people are trying to access public services, everything is designed for an individual user. So application forms are designed for an individual user. And more often than not, it's the case if you're trying to access public services, you might have a friend or a family member trying to help you. You might have some other kind of circumstances that make that application more complex. So, for instance, one of the things that we've been exploring is can processes be designed to accommodate what we're calling vicarious users, people around the person formally trying to access the service. Another interesting question that we're looking at in the lab is in terms of the design of digital government interfaces, which are really key to how we access public services these days, is the questions that government tends to ask of those services are things like, is the text clear? Is there sufficient information? Are we not overloading people with information? All about how these interfaces are kind of visually designed. The kind of questions we're seeing asked less often in service design is, are digital interfaces speaking down to people? Now, that might seem like an odd question to ask, but this is the kind of stuff that's coming back in our data. In terms of the way these systems are presented, the way text is set out, can we change that to make people feel like they're more having more fair experiences? The evidence that we're collecting suggests that that is possible. Interestingly, a lot of the issues that we're looking at in the lab seem to lead to ideas that don't necessarily require huge amounts of investment to change, but just require a bit more care in how processes are organized and designed. Obviously, money can make a huge difference, we all know that, but not everything is about money. Some of this stuff can be changed just with care and thought and we would say evidence as well. So that's a very quick introduction to the work of the lab. I just want to say a little bit about how we're organized. So basically, there's four things that really make the lab work well, in our view. So we're building an interdisciplinary team that's based largely at York, but also across the UK. We already, after the first year or so of the program, we have about 35 people working on different projects. We're also trying to bring through early career researchers, so that we're building the next generation of researchers in this field. We see the work of the lab, even though I'm based in the law school, the lab is not based in the law school, it's based at the university. And we see the work as the lab as inherently interdisciplinary. So we're working with psychologists, economists, political scientists, and so on. The second thing is we have a group of supportive funders. We always want more, but we have a group of supportive funders who help us do this work. Doing this work does take research funding, and we're lucky to have people that support us to try and advance this. On all of our projects, we're working with partners. So we're not just about trying to develop new theoretical models, or that's part of our work. We're trying to actually translate this into insights that can be implemented and change things for the better. We've worked with the Department for Work and Pensions on universal credit. We've worked with the Homes for Ukraine Task Force on the Homes for Ukraine research we're doing. We do more and more local partnerships with local government in York and close by. And we're increasingly trying to work with the private sector. So we're talking to energy companies and different other private sector organizations. We're hoping to try and break down the boundaries between practice in the design space in government and in charities and research in the university. And finally, the University of York is a natural home for this work. We have a long tradition here of taking public administration very seriously as a source of fairness in society. and we're looking to continue that tradition as well. This is just a quick overview of all the areas where we're working. You'll see there's a very diverse range of services that we're already conducting research on, and we're always very keen to expand what we're looking at. So if anybody has any ideas, please do feel free to reach out. If you want to follow the work of the lab going forward, then please just keep an eye on our website. We're going to set up a newsletter soon so we can share updates from there. Thank you very much.